Hello, welcome back. The topic today is frequent abdomen pain in children or chronic abdomen pain in children. The parents are really worried when their kid says, "I have abdomen pain," and they say all of a sudden, and especially in the morning time before getting ready to the school, they will say abdomen pain. So usually the mothers get panic. What could be the reason? So chronic abdomen pain in children or any abdomen pain in children is very common, and if it happens 3 times in 3 months, it's called chronic abdomen pain. Or now first we have to realize the child is still growing both physically and mentally. Physically, the intestine, stomach, even the liver, everything is still maturing. The muscles, the intestinal muscles are all getting more mature. Even the enteric nervous system, the nerves are getting developed. So when we introduce from mother's milk, lactation to other solid food, so pain can happen very simply because of still the digestive system is maturing, and this is very common. And there are so many other reasons a child can get abdomen pain. There is more than the gastrointestinal tract. There are other systems like your urinary tract infection can happen. So genitourinary tract is there. So suppose they have an infection in the urinary tract, they can get pain. They have a hernia, they can get pain. So many reasons are there. So but commonly we can group them into functional and organic abdomen pain. Functional, there is pain, but we cannot diagnose it physically. So this is little confusing, but this is very, very, very common. This is called functional abdomen pain. This is number one. Number two is called organic. Organic, the first and foremost is constipation. That's as we said earlier, the child is still growing both physically and mentally. So when we introduce newer and food, this constipation can happen. Gas colic can happen. This is very common. Some people have a diarrhea. So when the child is the mother, breastfeeding, so the bacteria is only the natural bacteria between the mother and the child only. But the moment the child starts, crawling or even starts walking, it goes to the bigger area. So they can introduce more and more infections can go in, and they have the habit, children put everything from whatever they get, they put it in the mouth, so the infection go in. There can be bacterial infection, there could be viral infection, there could be fungal, whatever it is, but most commonly bacterial and viral infection. And viral infection, viral gastroenteritis is very common in children. So, and not only that, infection from the urinary tract infection, especially a girl child or even a male child, urinary tract infection can cause severe abdomen pain frequently. And if they have an infection in the lower part of the lung or even the liver, they can give abdomen pain. So this is very bad. And infection could be from within or from outside also. It's very common. Then diet. As I told you earlier, from mother's milk, we introduce solid for the fourth month and introduce newer and newer food. So these food, still the maturing or growing gastrointestinal tract can give you pain. And they may have a lactose intolerance. They may be allergic to certain food. They may be allergic to certain vegetables, or these things can cause abdomen pain. So diet is very, very, very important. We all know the lactose intolerance to the milk part. Then emotional abdomen pain or emotional stress is very, very, very common. This is the most neglected reason for abdomen pain, because it's very difficult to understand, it's very difficult to identify, and unless we spend more time and frequent visits to the doctor, this is very easily yeah, we can avoid. We may not be knowing it. See, this emotional thing probably can happen because within the family, suppose there is a lot of the father and mother, if they have some issues that can affect the child, or some loss in the family, anything emotional things. So the child may not be able to talk or express, but they can feel that emotional stress, like they'll show it in abdomen pain. Or in the school, something, bullying, or maybe exams, all these things can cause stress. Or They can get, even children then can get, depression and all these things. They can cause abdomen pain. And there are other reasons, rare reasons, like uh, uh, abdominal migraine. So we all know migraine, we have a headache. So these kind of pain can happen in the abdomen also, but it's very difficult to diagnose. It takes a lot of time. We have to rule out other all possibilities. Then only we can come to a conclusion. Frequent abdomen pain, everything is normal, and family history. In the family, there are one or two people with migraine. Then the possibility of abdomen migraine is there. And apart from that, even appendicitis can cause infection, pneumonia can cause abdomen pain, urinary tract infections. All these things can cause, or even sometimes they're taking some medicines like for antibiotic or painkiller. They can cause gastritis, abdomen pain, and keep on happening again and again. So a certain food, like best example is always mangoes. The mangoes is a seasonal fruit. The season they will take too much of mango. It's a citric uh, fruit which causes gastritis, and they can get, all of a sudden they can get abdomen pain. So these are the common classification of the reasons for the abdomen pain. So when to worry as a parent or as a mother? So suppose the child says, I have abdomen pain, should I panic? Definitely no, is very common. But when to worry or when to ask for a medical help? So the pain, if it disturbs the child's sleep, during sleep the pain is so severe, the child gets up from the sleep out of because of the pain, then probably we have to look deeper. Number two, abdomen pain with fever, abdomen pain with weight loss. Because of the abdomen pain, they may stop taking food. The nutritional deficiency can happen. They lose weight. So unexplained weight loss. All these things with the pain is little we have to look deeper. The same way, if they have abdominal pain with vomiting, if the food is okay, but vomiting with blood or even sometimes bile, these are we have to look little deeper. Or passing abdomen pain and passing blood in the motion, stool. This also has to be taken little seriously. So the doctors, you have to reach the doctor. The doctor, usually the pediatrician will examine the child. They may ask for blood tests, a scan, all these things, or even sometimes they can ask for an endoscopy and colonoscopy, because children also can get ulcers. They can also get inflammatory bowel diseases. So these are things will show what could be the reason for the chronic abdomen pain. But generally, abdomen pain, no need to worry. But if it happens with fever, vomiting, blood in the motion or blood in the vomiting, the child wakes up during sleep with the pain, then definitely you have to see the pediatrician. Thank you.